So finally, let's talk about renal failure. So another fascinating topic. So renal failure can mean one of two things. It can mean chronic renal failure or it can mean acute renal failure. And both of those terms have kind of gone out of fashion now and been replaced by new terms. So chronic renal failure has been replaced by CKD, which stands for chronic kidney disease. And acute renal failure has been replaced by AKI, which stands for acute kidney injury. So let me give examples to illustrate what both of these mean. So let's start with CKD. So if someone has a disease that is gradually leading to degeneration of their kidneys, this is what's going to gradually result in CKD. So a nephropathy, this is a very useful word. Nephropathy, nephro refers to kidneys, pathy means disease. So this is a disease of the kidneys. So the two most common ones are high blood pressure causing gradual loss of nephrons, gradual degeneration of the kidneys, and diabetes causing gradual loss of nephrons and gradual degeneration of the kidneys. And these would be referred to as hypertensive nephropathy and diabetic nephropathy, respectively. Now, what are the major functions of the kidneys? Well, they have a huge number of functions, but their main one, the one that you'd say first above all others, is that they get rid of waste products. So our body, all the cells of our body are continually producing waste products, dumping them into the blood, and then it's the job of the kidneys to then get rid of these waste products and put them into the urine, which we then pee out. That's their main role. If the kidneys gradually degenerate and you lose nephrons, then they lose the ability to do this, and the waste products gradually get higher and higher in the blood. So the lower your renal function becomes, the higher the waste products become in the blood. And we measure two of the waste products clinically very regularly, and I'll just write these down for you. So two waste products that are extremely important in clinical medicine are urea and creatinine. These are both waste products produced all over the body, dumped into the blood, and then the kidneys excrete them. Now the normal levels of them are, for urea it should be between 2.5 and 7.5 millimolar, and creatinine should be between 50 and 120 micromolar. Now, in someone who has got chronic disease of the kidneys, that is reducing the ability of them to do their main job, which is get rid of waste products, then the way that you can see that this is happening is by measuring these waste products, and you will see that they are higher in the blood. So people with CKD, which is permanently reduced renal function due to nephropathy, will have higher baseline levels of urea and creatinine. Their levels will always be too high. So their urea might be 20 at baseline and their creatinine might be 200 at baseline. So much higher than the normal rate. And that would indicate, if it's always like that, it would indicate that they've got a chronic disease of the kidneys, a chronic failure of the kidneys, a chronic renal failure. But as I say, that term's gone out of fashion and we say a CKD now. So CKD, therefore, is chronically reduced renal activity, chronically reduced renal function due to the fact that their kidneys have permanently been damaged by some sort of kidney disease. In contrast, an AKI is where renal function temporarily, acutely worsens, but then it reverses back to their normal after whatever has caused the AKI has been resolved. So an example of when this can happen is if an individual is extremely unwell. So let's say if we've got a 80-year-old lady who has got pneumonia. So pneumonia is an infection within the lung tissue. So let's say her right lung has got a really severe pneumonia occurring in it, and that she's really septic from this. So we talked helpfully about this earlier. Sepsis is where the cytokines from the infected tissue are so high that it starts to interfere with the functioning of other parts of the body in a detrimental fashion. So this elderly lady might be completely delirious because of the effects of the cytokines on the brain. But one of the things that sepsis can do is those cytokines can interfere with the activity of the kidneys and cause them to fail. So the cytokines can stop the nephrons within the kidneys functioning properly. They therefore stop getting rid of waste products from the blood properly, and the waste products therefore will go up in the blood. So you'll see urea will go too high and creatinine will go too high. So her urea might go up to 20, her creatinine might go up to 200, even though she might not have CKD. So her kidneys might be beautiful, they might be absolutely beautiful. None of the nephrons have degenerated. She's got brilliant numbers of nephrons. They usually function absolutely wonderfully. But because she's currently septic, those cytokines are interfering with the function of the nephrons, stopping them excreting the waste products properly, and therefore the waste products have acutely, temporarily gone too high within her blood. That is what we call an AKI, an acute renal failure. And then if she recovers from this, if she survives this pneumonia, so if we give her powerful intravenous antibiotics, kill the bugs in her lungs, and she gets better, she comes out of the delirium, becomes lucid again, the cytokines within her blood go back down to normal levels, and her kidney function will then turn on because the nephrons haven't been permanently damaged by the cytokines. They've just been turned off. They're misfunctioning because of the cytokines, but they haven't been permanently damaged by the cytokines. That's the difference between CKD and AKI. In CKD, the kidneys have been permanently damaged by some sort of kidney disease that has led to degeneration of the nephrons, whereas in AKI, really, it's more that the nephrons are temporarily not working properly. And that one of the major examples of how that can happen is from sepsis, and we would call that a sepsis-induced AKI. So back to ibuprofen. So we've already said that certain prostaglandins are extremely important for the functioning of the kidneys, and we talked about in heart failure how they're important for making sure that the right amount of salt is excreted and not too much is retained. However, they are also important in making sure that the nephrons excrete the waste products correctly. And when you get rid of those normal prostaglandins, what can happen is the nephrons can then start to misfunction, and they can start then to not get rid of waste products correctly, and waste products can start to build up in your blood. Now again, if your kidney function is normal, this is probably not going to be a significant effect. If a 20-year-old takes some ibuprofen, their waste products, their urea and creatinine, are almost certainly not going to go up from the ibuprofen. However, if an individual has CKD, so a really bad baseline level of renal function, so normally their urea is 20 and their creatinine is 200 at best, so their kidneys are already awful, not good at all, then if you give them ibuprofen, it might then tip them further towards uremia, which is a word meaning too high waste products in the blood. So you do not want to be giving ibuprofen, a drug that is going to further potentially worsen renal function to someone who already has CKD. In addition, in an individual who has AKI, maybe from sepsis, you again don't want to be giving them something that's further going to potentially worsen their renal function at a time when their renal function is already very bad from the sepsis. So if someone's in full-on sepsis with AKI from an infection, you don't want to be giving them ibuprofen. Even if you want to give it as an antipyretic effect, you would want to think twice about what effect this is going to have on their kidney function. So always when giving this drug, it's about weighing up benefits versus potential risks. So this is another situation then where you want to really think twice about prescribing ibuprofen to anyone with renal failure, either chronic or an acute. So to summarize, the side effects of ibuprofen and other non-steroidals are: 1, it worsens asthma; 2, it increases stomach acidity, making you more at risk of getting ulcers that can bleed and perforate; 3, if you have ischemic heart disease, it increases your risk of having a heart attack; 4, if you have cerebrovascular disease, it increases your risk of having a stroke; 5, if you have heart failure, it's going to worsen your salt retention and therefore worsen your fluid overload; 6, if you have renal failure, it's going to worsen your renal function and make your uremia, the waste products accumulated in your blood, even worse. And this is why, overall, I generally end up only prescribing this to people under the age of 60, because once you're over the age of 60, almost certainly you're going to have one of the conditions that you want to avoid prescribing this drug in. So we'll end there. I am aware that we've had now, I think, 4 videos of all this doom and gloom about ibuprofen. I do just want to go back to the positives. It is a very effective antipyretic, and it is a moderately effective painkiller and anti-inflammatory. So it is a good drug. You just need to make sure that the person that you are prescribing it to is going to get more benefit from it than damage. So overall, children and younger adults who have no medical conditions and are on no medications, they are the people who are good candidates for being given ibuprofen. And with that, we'll end this video. Thank you for watching. I hope you've enjoyed it and I hope you've learned something.